One time I noticed a mistake was I was in the emergency room and we were seeing a patient. Um, she was in her low 30s, um, coming in for some chest pain and shortness of breath. We had a pretty high suspicion that she was having an anxiety attack, but we did our due diligence and we got some labs, worked her up just to make sure there was nothing life threatening. And after a few hours, all the labs came back and everything was normal. And the resident and attending were talking about discharging her, but I was, following up and looking up her results, and I couldn't find an EKG, which is really important part of working up a patient for chest pain. Um, and it was a pretty simple fix. Just I spoke up, and I think that's the most important thing you should do, whether or not you're a first year medical student, fourth year, um, nurse, PA, or NP. I think speaking up when you see something's missing or there's a mistake can have a really big impact on patient care. Uh, really, could we have sent her home and she probably would have been fine? Yeah, all of her other workup had been normal, but there's just always that chance that you gotta, you can't take that chance really. It could there like 1 in 100 chance where it could actually be make a big difference and you could catch something serious. So I spoke up and really the residents and attending, it didn't hit their ego or anything. They realized that yeah, we really did need an EKG, so we got one. It delayed the discharge, unfortunately, and that in the ER, it's always about moving patients through, but it was definitely the right thing to do, and I'm glad we did it, or I'm glad I did it, I guess. Uh, and even though it was a normal EKG, it was still the right thing to do.